Hi, everyone. My name is Paris Goodyear Brown, and I am the creator of the Trauma Play Model, and I am the clinical director of Nurture House, a sweet treatment facility in Franklin, Tennessee. So we know that a lot of the children that we see who have big behaviors really have an underlying need that has not been met yet. And if we can shift from and really help shift paradigms for caregivers as well, from seeing the child's behavior as controlling and manipulative in and of itself to asking this question, what is the underlying need that's not being met yet? I think that we can shift the way whole school systems interact with children, whole families heal together, and certainly how we show up in our treatment sessions with kids and parents together. At the heart of trauma play is parents as partners in the process and using the attachment relationship as the foundation of all of our interactions with each other. I'm going to show you one today, just one intervention that is in the book. I'm actually out in LA and not in my beautiful library in my home in Fairview that I love to teach from. So I have behind me this graphic, Every Family Has a Story. And I do believe that it's especially true in the wake of COVID, that there are more stories of trauma, hardship, stress, disconnection than there have ever been in our world. And so we developed some new ways of working when we were working with Zoom through the screen. And I would meet with the parent and child, and there would be hard things that had been happening. We would first start out with delighting in experiences. And if you come to the training, you will learn some of those playful ways, games for delighting in each other, helping parents and children to bring back the joy when they've been in such distress. We would start there, and then we would begin to dig into the hard things. And so this activity is called Excavating Hard Things. And it is, you simply need some sort of soft, malleable material in your environment. Um, I like to use Play-Doh and Legos, especially for my latency age boys. They really like the Lego work. And so we will embed little hard Lego pieces into Play-Doh and smooth it out into a ball. And then we'll talk about how the outside may look smooth and okay, but actually there can be really hard things happening inside. And then we begin to using either chopsticks or tweezers, or sometimes knitting needles if we're in our art room where we have a big jar of knitting supplies. You can also use just a pencil or even your finger to excavate the hard things. But I'll ask the parent, sometimes a child on their own in an individual session, or a parent and a child together to go and find materials. And I actually just got off a training where someone had used yogurt and trail mix. Yogurt was the softer material. Trail mix was embedded in it as the hard things. I've had parents when it was the really height of the pandemic, they would go into their pantries and I would follow them on the phone through Zoom into their pantries. We would find peanut butter and dried rice or dried beans could be the hard things embedded in the peanut butter. If you were taking a child or a parent-child dyad out into nature, you could make mud pies and embed stones and twigs and other hard pieces of things into the mud pie. And that could become the way you do this work. Again, out here in LA, not having any of my normal supplies, I just raided my brother's kitchen and found this honey pecan Philadelphia cream cheese. So I'm going to excavate in this way. One of the things that is seminal in the trauma play model is a value in titrating the dose of exposure to hard things. So when I do this excavating activity, what I might do first is simply have the child or parent pull one of the hard things out and just give it a name, just title it. So they don't have to talk yet in detail about the hard thing that happened or draw about it or create sand trays or really press in. It's a first glance. It's a dose of the hard thing in a distanced way by titling it and labeling it over here. So they would pull one out, a piece of pecan, and they might say, Um, One of the ones that just showed up this morning was grief and gratitude might be what's said. I had a teenager last week who said um, unraveling connections because her social life is kind of in a shambles at the moment. She's felt like she's lost her friend group. And so, this excavation, what I'll do is ask the child to notice what it feels like as they excavate. If they don't have words to create a title, that's okay. They can just excavate and notice how it feels to pull out this hard thing from inside the rest. And that's just one. We use that. You can use it, especially if you're trained also in EMDR, which I am a EMDR approved consultant. So you can add the EMDR bilateral stimulations into the work. You can use this as trauma targeting, helping to create the set of trauma targets you might use. And it's a first look at what might be some of the harder things that need to be addressed in the course of treatment. And then we go right back to other playful interventions, and you have a bit of a template for what the work longer term might look like.